This is a brief introduction to persistent dysfunction following mild concussions. I'm Dr. Leonard Matheson. We'll begin by defining mild traumatic brain injury, mTBI, and exploring the recovery timelines that we usually see. We're going to be introducing the idea of persistent post-concussion symptoms, PPCS, and talk about its prevalence and symptom types. Next, we're going to take a look at the neurobiological mechanisms and brain dysfunctions that occur, followed by a discussion of the risk factors associated with PPCS as a consequence of mTBI. We'll wrap up by taking a look at the implications on quality of life and rehab management, and then wrap it up with conclusions and future research directions. So what is mTBI? A mild concussion, or TBI, represents a brain injury caused by a jolt or impact to the head. It temporarily disrupts brain function, leading to symptoms like confusion, headaches, and dizziness. It's crucial to understand mTBI because symptoms may persist long after the initial trauma, influencing recovery strategies and safety protocols in sports. Most people typically recover from mTBI within several weeks, although the recovery might vary from person to person. Symptomatic recovery generally occurs within weeks, with many regaining full function between 2 to 3 months post-injury. Approximately 50% of the concussion patients become asymptomatic by 1 month after injury. Persistent post-concussion symptoms, PPCS, refers to ongoing neurologic dysfunction following a concussion. Symptoms such as headaches, dizziness, and cognitive difficulties can persist beyond the expected recovery period. Persistent symptoms are reported in 10% to 15% of mTBI patients, indicating ongoing effects post-injury. Among adults, a range of 15% to 30% report symptoms 3 or more months after a concussion. With young patients, about 30% of children and adolescents face prolonged symptom post-concussion, and this requires targeted management strategies. There are 2 different symptom types, somatic and cognitive and emotional. People with somatic symptoms experience persistent dysfunction after mTBI, like headaches, dizziness, fatigue, and sensitivity to light or noise, affecting daily activities. Cognitive challenges such as attention deficits and memory problems are frequently observed alongside emotional disturbances like mood swings, which contributes to psychological stress after a concussion. This section explores the underlying neurobiological basis of brain injuries and dysfunction that results from mTBI. Let's take a look at brain damage and compare it with dysfunction. Understanding what we mean by brain damage is vital because it encompasses a range of conditions including mild traumatic brain injuries. Imaging studies such as CT or MRI usually don't reveal abnormalities, which leads to misconceptions about the patient's cognitive function. This underscores the need for comprehensive evaluations beyond traditional imaging to assess potential long-term neurocognitive dysfunction. There are important risk factors that we have to be concerned about. A previous history of concussions, because past concussions can increase risk. Pre-existing conditions like migraines raise persistence. Pre-existing anxiety and depression raise the likelihood of persistent post-concussive symptoms. Gender is an important issue because gender studies suggest that women are at higher risk of PPCS. And then older age is also important because older age impacts recovery outcomes. So what are the implications? Persistent dysfunction affects quality of life, work, and social interactions. Experiencing persistent dysfunction after a mild concussion can drastically impair quality of life. People who struggle with daily tasks, social interactions, and overall well-being begin to have feelings of isolation and frustration. Understanding these impacts is crucial for effective rehab and support. Follow-up care is essential for patients experiencing persistent symptoms after a mild concussion. Evaluating these conditions helps determine the most effective treatment approach to ensure that patients receive timely support. Effective treatment plans are key for individuals with ongoing symptoms from mTBI. We need to rule out other medical issues so that we can guide patients towards appropriate therapies for recovery. So in conclusion, research shows a significant proportion of patients between 10 to 30% face persistent dysfunction post-concussion. Such long-term issues can severely impact their quality of life, highlighting the need for effective management strategies and ongoing support for affected individuals. In the Journal of Neurotrauma, February 2022, this large-scale prospective multicenter study found that a significant portion of individuals with TBI, including mild TBI, continued to endorse 3 or more symptoms 12 months post-injury. This research challenges the notion that most mTBI symptoms resolve within 3 months and highlights that persistent symptoms are common for at least a year. You can access this study by using the reference PMC 8892966. PMC 8892966. Another study in neurology in May of 2018 was a large longitudinal cohort study of United States veterans. Half of them had TBI. The study found that even mild TBI was associated with a significantly increased risk of Parkinson's disease. Among military veterans, mTBI was associated with a 56% increase in PD even after adjusting for various factors. One of the important aspects of this study is that mTBI can lead to long-term neurodegeneration. This study can be accessed by reference to PMC 5957305. PMC 5957305. This comprehensive review of studies in 2024 concluded that there is consistent evidence of cognitive deficits such as memory, attention, and executive dysfunction following mTBI. mTBI can lead to significant long-term cognitive impairments that impact quality of life. The authors cautioned, however, that while biomarkers show promise as tools for diagnosing cognitive impairment after mTBI, more research is needed to establish their utility in clinical practice. This study can be accessed through PMC 1097-1996/MDPI. So thank you for your interest. Persistent dysfunction following mild concussions is an important problem that we all need to take seriously. Take care now.